Developing a drug that inhibits a desired target without disabling other vital proteins is a formidable challenge even for the best of medicinal chemists. And the uncertain journey from a successfully cloned drug target gene to the widespread availability of an FDA-approved pharmaceutical is a veritable odyssey that seldom takes less than 10 years. Success stories are hard to come by, but will, I am sure, become more common. Discovered by chemists at the Swiss company Novartis, Gleevec works against a blood cancer called chronic myeloid leukemia, CML, by specifically blocking the growth-stimulating activity of membrane receptor proteins that are overproduced by cancerous cells of this type. If given early in the course of CML, Gleevec generally leads to long disease-free remissions, and hopefully in many cases to true cures. For some unlucky individuals, though, the disease reappears when new mutations in the gene encoding the membrane receptor proteins render Gleevec ineffective. One of the most important anti-cancer drug target proteins may be the receptor for epidermal growth factor, EGFR. This receptor frequently shows up in much higher quantities in cancer cells, particularly in breast and lung cancers than in normal ones, which suggests that it may well be a winner as a drug target. Several potent drugs that specifically block EGFR action are now in late-stage clinical testing. But while the arrival of target-specific drugs will certainly introduce big new guns in the war against cancer, the likelihood is that after initial remission, many patients will suffer a relapse as resistance to the new drugs evolves among the cancer cells colonizing the body. For this reason, many have come to believe that a better long-term way of fighting cancer cells may involve targeting their nutritional lifelines. They, like all cells in the body, need nutrients to grow, and they receive these nutrients from blood vessels that grow near them. If you block the growth of blood vessels into tumors, you can eventually starve to death the cancer cells they serve. The idea that small tumors become dangerous only once they are infiltrated by newly formed blood vessels, a process called angiogenesis, first occurred to Judah Folkman in the early 1960s, while he was doing his military service in the Naval Medical Research Institute outside Washington, D.C. The precocious son of an Ohio rabbi, Folkman was the first graduate of Ohio State University to enter Harvard Medical School. By the time he went to high school, he had already assisted in surgery on a dog, and in college he invented a surgical device to cool the liver when its blood supply was temporarily cut off. At 34, he became the youngest professor of surgery in the history of Harvard University. Folkman's anti-angiogenesis ideas could not, however, be explored therapeutically until the recent discovery of 3 specific growth factors that play vital roles in the growth of endothelial cells, those that line blood vessels. Inhibitors developed against these growth factors, anti-angiogenesis drugs, might very well prove effective against many forms of cancer. Some 40 years after Folkman's original insight, we may at last be able in the foreseeable future to cure most cancers, including those that have become resistant to the best conventional anti-cancer drugs. Already, Sugen, a firm outside San Francisco, has developed 2 highly specific small molecule drugs that work against distinct angiogenesis growth factors and inhibit tumors in model animal systems. Neither drug given separately has yet proved effective against advanced human cancers. However, preliminary data from experiments with cancer-prone mice done by Doug Hanahan at UCSF suggest that Sugen drugs might have worked had they been administered in tandem. Unfortunately, the future of onco-mouse experiments at UCSF and elsewhere is jeopardized by the ongoing dispute provoked by DuPont's aggressive onco-mouse licensing policies. Blood vessel infiltration into mouse tumors has also been prevented by a newly discovered group of proteins that are likely naturally occurring inhibitors of blood vessel formation. Two such proteins, angiostatin and endostatin, isolated by Michael O'Reilly and Judah Folkman's lab, are currently in clinical trials. While neither is present in blood in amounts large enough to be extracted for human testing, recombinant DNA procedures permit both proteins to be made in yeast cells in quantities sufficient for clinical use. And while neither angiostatin nor endostatin alone has yet demonstrated miracle-like anti-cancer effects in humans, mouse experiments suggest that, as with Sugen's drugs, an efficacious combination of the two may soon be discovered. Over the next decade, a virtual armada of small molecule and protein inhibitors will probably be ready to sail through the systems of cancer sufferers, thwarting blood vessel formation before tumors have a chance to become lethal. And if tumor growth can indeed be curtailed in this way, we may come to regard cancer, as we do diabetes, as a disease that can be controlled rather than completely cured outright. Since recombinant technologies allow us to harness cells to produce virtually any protein, the question has logically arisen: why limit ourselves to pharmaceuticals? Consider the example of spider silk. So-called dragline silk, which forms the radiating spokes of a spider web, is an extraordinarily tough fiber. By weight, it is 5 times as strong as steel. Though there are ways spiders can be coaxed to spin more than their immediate needs require, unfortunately, attempts to create spider farms have foundered because the creatures are too territorial to be reared en masse. Now, however, the silk protein-producing genes have been isolated and can be inserted into other organisms, which can thus serve as spider silk factories. This very line of research is being funded by the Pentagon, which sees Spider-Man in the U.S. Army's future. Soldiers may one day be clad in protective suits of spider silk body armor.